Polysomnography reveals decreased REM latency and decreased sleep latency. CSF would reveal a decrease in which hormone? Well, first we have to know what is the diagnosis. So what sleep disorder would result in a decreased REM latency and decreased sleep latency? Well, the answer is narcolepsy. So which hormone is decreased in the CSF of narcolepsy patients? And the answer is orexin. Orexin is also known as hypocretin. So if you see a decreased level of orexin or hypocretin, think about narcolepsy. Patients with narcolepsy can experience excessive daytime sleepiness or even hallucinations. So let's say that you have a 19-year-old male that presents complaining of an irresistible urge to sleep at sudden times throughout the day. This has disturbed his functioning at school, and he sometimes feels paralyzed for several minutes when he wakes up. He also notices that he sees weird things when he's about to fall asleep, and he often passes out during school or at home, basically everywhere. So in this situation, the most likely diagnosis would be narcolepsy. And in order to treat these patients, the first line drug is modafinil. But aside from pharmacologic intervention, you can also implement sleep regulation such as scheduled daily naps. What is the most likely diagnosis in an obese patient who presents with loud snoring, morning headaches, and 4 to 5 jerks of lateral gaze? Sleep-related hypoventilation, or SRH. The hypoventilation that these patients experience may be due to breathing that is too shallow or too slow, obstructed airways, or restricted or damaged lungs. What is the most likely cause of a patient who has schizophrenia to develop mouth ulcers after starting a new drug to treat their condition? Agranulocytosis. So this can be due to drugs such as Clozapine. Patients who are on Clozapine require weekly white blood cell monitoring, and if they do develop agranulocytosis, then you want to treat by stopping the drug, implementing a neutropenic protocol, and possibly giving them filgrastim as well. What hormone is likely to be elevated in a patient with major depressive disorder? Cortisol. Okay, what is the most likely diagnosis? You have a 64-year-old female where her husband recently passed away just 3 months ago, and sometimes she reports that she hears his voice. On the other hand, you have another 64-year-old female, and her husband passed away 7 months ago and reports feeling very tired. She started abusing certain substances and avoids any reminders of her husband. What is the most likely diagnosis in these two scenarios? So as you can possibly tell, we are evaluating grief. So what type of grief are they experiencing? Well, the first patient is experiencing normal grief. I wanted to bring out this point because oftentimes when you see that, oh, they're hearing their loved one's voice, you're saying, oh, this must be pathological. But no, that is or can be a part of normal grief. However, for pathological grief, you want to think about someone who really avoids anything to do with the person that passes away. Like they avoid any any reminders. They avoid going through the process of grief, and they start to develop new habits that they haven't done before that are harmful. For example, this patient that had started using new substances. What is the treatment of choice in a patient with Parkinson's who presents with a 4-month history of paranoid behavior? Clozapine or clonidine. So it's very high yield to know that patients with Parkinson's disease can develop these different changes in, how they act or personality or mood. So it's very important that you evaluate these patients and see what is going on so that you can just treat that specific presentation or new clinical presentation to manage their symptoms. A patient with major depressive disorder has discontinued paroxetine and has started phenelzine 5 days later. What is the treatment of choice of the condition that may result? Cyproheptadine. So the most likely condition that could result in this patient is serotonin syndrome. So recall that paroxetine is a SSRI, while phenelzine is a MAOI inhibitor. So what happens is if you're switching from a SSRI to a TCA or MAOI, then you want to have at least a 2-week washout period in between so that you don't have extremely elevated levels of serotonin that can cause patients to develop serotonin syndrome. Recall that patients with serotonin syndrome may present with hyperreflexia, hypertonia, elevated body temperature or fever, spontaneous clonus as well. They may also have autonomic instability such as heart rate changes, sweating, shivering, and flushing. So treatment typically includes withdrawal of the offending agent, benzodiazepines to treat agitation and tremor, but the antidotes per se for serotonin syndrome is cyproheptadine. What is the diagnosis? So again, we have 2 patients here. One is a 16-year-old male that has been suspended 3 times for his behavior, steals from his parents, and has shoplifted. While in scenario B, we have a 24-year-old male fired for stealing from his job, arrested for theft, and kicked out of college for cheating on an exam. So what is the diagnosis in these patients? I'll give you some time to think about it. So for scenario A, the patient has conduct disorder. This is present in patients less than 18 years old and is also considered to be a precursor to antisocial personality disorder. Basically, patients with conduct disorder, they're less than 18 years old and they have a consistent behavior that violates social norms, and they can even break the law at this point. So let's say that you have a 13-year-old who has been suspended from school 10 times for stealing from children or bullying other children, and they describe like his school performance as being poor and he doesn't really have any friends. So this patient could have a conduct disorder. Of course, there are other possibilities that you need to consider. In scenario B, however, this is antisocial personality disorder. So typically conduct disorder greater than 18 years old or in patients older than 18 years old is classified as antisocial personality disorder. So these patients basically have they're doing the same things as conduct disorder. So they're breaking the law. They're doing things outside of social norms. But it's very important that you are able to distinguish between conduct disorder and antisocial personality disorder, because examiners like to test you on this concept, and they can have both answer choices. But the main thing that would help you to differentiate between the two is the age of the patient. What is the treatment of choice of a patient who has a history of depression and develops a blood pressure of 220/100 after having red wine? Well, the answer is phentolamine. So it's very important to note that if a patient is being treated with depression and then they have these extremely high blood pressures, you want to think about the first thing is that what drug could they be taking that could be causing this? What drug or interactions is happening here? So in a patient with a history of depression, one possible drug that they could be taking that could cause really high blood pressures is MAOIs. When you take MAOIs and alcohol, this can lead to a hypertensive crisis. It can also happen if you have certain foods such as aged cheese as well. So patients on MAOIs need to have a very specific diet or just try to avoid certain things. So a quick aside on phentolamine. So the mechanism of action for this drug is that it reversibly blocks alpha 1 and alpha 2 receptors. The blockage of alpha 1 receptors cause decreased vasoconstriction, which leads to a decreased blood pressure. It's important to know that phentolamine has no effects on beta blockers, just on the alpha receptors. So because it decreases blood pressure, this is why clinically we use phentolamine in patients with who are taking MAO inhibitors who eat tyramine containing foods and develop a hypertensive crisis. So when you think about adverse effects, one possible adverse effect is orthostatic hypotension, reflex tachycardia. What psych disorder is most common in patients after they experience AMI? Well, to get the answer to this question, just continue watching this psych series. And if you like this type of content, please be sure to pop that like button, hit subscribe, and that notification bell so that you never miss another video like this.